Hey, Christine. I'm so excited to get started.
Yes.
Well,
love this topic.
this is a great topic. We've got an exciting show for you guys. We finally are having decent weather in Iowa.
It's been so nice.
I've been able to get outside. You saw us hopefully grill the last couple of weeks. You saw our video last week on that. So let us know that you're here. Let us know your name and tell us where you're viewing from. We like to see that we're hitting all four corners of
Yep,
Iowa.
exactly.
But we do have a great talk for you guys. Christine and I are here to talk with you guys about supplements. So what are those vitamins, those minerals, all of those things that you can buy over the counter or that you see online that are saying, hey, we can cure diabetes? We're here to talk about a lot of those. We definitely know everything about all of them, but we want to give you some of our honest opinions about many of the more common ones out there. But we're also willing to take those questions from you guys. Let us know what your questions are on these different topics so that we can give you value, help you guys out. So the first thing to start us off is a little quote for you guys. This one's coming from Dr. Royal Lee, and he says, the body cannot make something out of nothing. Just kind of a quick reminder, like no matter what we take, what medicines we take, what supplements we take, if the nutrients aren't there, it can't fix everything.
There has to be the right combination.
Yep. And it's a balance. And here at Iowa Diabetes, we really do like to talk about that balance. We're going to talk about with you what you eat, what medicines you take, what exercise you do, because it really takes all of that.
It really does.
Little poll for you guys. How do you feel about supplements? So let us know.
A is I love them. B is I don't know a lot about them. And C, I don't think they work.
Let us know what you feel and how you feel about those supplements.
We'll give a second before we share our answer. Are you sharing our answers too?
Yeah, absolutely. I'm going to share the answer. We've got Tyler. Hey, Tyler, thanks for joining us. You're a B, don't know much about them. So maybe stay away from them because you don't know much about them. I'm like in between an A and a B.
Okay.
And there are some that I will say a C.
Yeah. I'm going to agree with some as a C. There are some that I'm like 100% an A.
Yeah.
So,
yeah, I would agree. There are some things that you can do over the counter that you can take that will have a huge impact on your health. Not just diabetes, but on your health.
Yeah, in general.
There's others that I'm like, don't waste your money on those.
Yeah, we're going to go over those
today. $60 a pop. Let's not waste our money on some of those.
So, and when we're talking about some of these supplements, we're basing this too off of like what actually has been researched.
Yes.
And has proven to show some positive results for diabetes. So they're not just us saying, yeah, we like them and here's why. It's also based on like what has been shown scientifically.
Yeah. And we did not do all of the research. We had some good pharmacy interns that did a little bit of the extra research for us, but we do have quite a bit of knowledge to share. The first thing is, what is actually a supplement? So Christine, like in your own words, how do you describe a supplement?
I mean, a supplement's going to be a vitamin, a mineral, essentially something, or, greens, something that you're going to be taking that's either naturally made or synthetically made, but something that you're giving your body that you're not getting necessarily from your food.
Yeah. And I would agree with that. It's going to be something that you can buy over the counter. It's not going to be classified as a medicine.
Correct.
Tyler, you're saying that you take a multivitamin and that you also have magnesium. Other than that, don't really do supplements. And I think that's okay. I think there might be some things that we can talk with you about that may enhance what you're doing with your food and your nutrition. These are meant to help in some of those situations where you can't get some of these things from the food that you're eating. So, so the first supplement that we are going to talk about, I'm going to show you guys a picture of it. We're going to talk about probiotics first. So probiotics, prebiotics,
Okay.
hot topic.
Yeah, it really is.
So Christine, you are more of the expert on this than me. So why do you like these so much?
Well, first off, so a prebiotic, you hear that. What is prebiotics? That's essentially fiber, the food that your gut, I call them gut critters, essentially the bacteria in your gut that actually play a very important role in a lot of functions in our body. They need proper nutrition. But a lot of times, let's say you've been on antibiotics or you're not quite getting the mix of foods in your diet or other things, you are sick. There's lots of other factors that can affect your gut flora. And if your gut flora is not healthy, it's going to affect a lot of different systems. It affects inflammation.
Mm-hmm.
It affects your blood sugars. It affects how well your body can signal to the brain that you're full. It affects your immune system.
Mm-hmm.
It even can affect the production of serotonin, which is like your happy hormone.
Yeah.
So there's so many systems in the body that if that gut flora is not healthy, there can be side effects to how we're functioning.
Yeah, and more research is saying a healthy gut flora, those people that have it have less risk for type 2 diabetes.
Right.
So we definitely want to have happy gut flora to make sure our body's working right.
Exactly. And that's a variety of bacteria. So when you're looking at a probiotic, look for probiotics that don't just have one type of bacteria, but have a good variety, because it's that balance of different bacteria in our gut that actually have different functions in our body.
Yeah. So I think that idea of that prebiotic or the food for the bacteria is good so that they are good and healthy. But that probiotic, that's when they get wiped out, right? Like an antibiotic or something that has wiped out your bacteria and your gut is not healthy. Right. You may be showing signs of diarrhea.
Yeah, bloating, even weight around the abdomen can be a sign of that flora being out of balance.
Yeah. And so I think taking that probiotic really helps you rebalance everything out. Right. And so it's, again, looking at there and making sure that your probiotic is not just one bacteria, but it's multiple bacteria. Right. So Tyler, you're asking, can taking a probiotic create a chance of having too much in your system?
And usually with your body, it has a way of balancing things out. For me personally, I'll do my probiotic. When I first started, I did it daily. And then once things are established, then I'll do it, every other day.
Okay.
It's typically, but there's foods that naturally have bacteria in it that you can take daily and aren't going to cause any harm.
Yogurt.
Exactly. But you got to have to listen to your body. Are you getting extra bloating if you're taking too much of the probiotic? Are you having problems with your stools? Those can be signs that your body probably has enough and that you can alternate to every other day.
Okay. And the other thing, these aren't going to cause infections. These are healthy bacteria that aren't going to cause infections in anybody. And having this healthy balance, you will find that you're digesting food better.
Right.
And you're feeling better, feeling less bloated. And you'll see an effect on your sugars because you're digesting better as well.
Yeah, there's been a lot of research that probiotics can lower your total cholesterol, which is awesome.
Yep.
Reduce your CRP. So what CRP is a sign of inflammation in your body. And obviously inflammation can cause a lot of issues, especially with joints and pain and so forth, heart disease, all sorts of things. So lowering that is important. It can lower A1C, fasting blood sugars, but then raise your HDL cholesterol, which is the healthy cholesterol. Yep. So that's a lot of factors that are actually going to directly affect diabetes.
Absolutely. Our next supplement, one of the ones that I think I get questions about as a pharmacist the most, cinnamon.
So can I just sprinkle cinnamon on some food and I'm good?
No, you cannot. You can sprinkle as much cinnamon on your food for taste that you want, but just using that small amount, definitely not going to be enough for what we're needing. Cinnamon it is one of those that has the potential to have an effect on your blood sugars. If you take the right amount, it can lower your fasting blood sugar by about 25 to 50 points.
Okay. That's a good amount. No, not at all.
There's not enough studies to see what that does on your A1C, because that A1C is a reflection of the last 3 months.
Right.
So the blood sugar it's much easier to collect that
Mhm.
data. So if you're using the right form of cinnamon and enough cinnamon, you can do it. But you can't get it from the food that you eat. If
Okay.
you would, it would be worse than a hot ball if you've ever had one of those.
So hot tamales don't count.
No, hot tamales
Okay.
don't count. So the type of cinnamon that you want to look for is the cassia cinnamon.
Okay.
It's CASSIA. And it's a type of cinnamon that is from southern China. That's the cinnamon that has been studied and
Okay.
we know lowers the blood sugar. Luckily, that's the most common type of cinnamon that's sold in the United States. So we're good if you're just going to the shelf and buying it
Right.
off of like an over-the-counter one. That's what you can look at. You want to take probably about 600 milligrams is what I recommend taking. It's been studied anywhere from 120 all the way up to 6 grams. So there's a wide range.
Yeah, that is a wide range.
But usually about 600 milligrams is what you're
Mhm.
looking for. April, you've got a question. Thanks for joining us. I have a friend that drinks cinnamon tea every day and swears that it helps. And I would look in there and see how much cinnamon is
Mhm.
in that cinnamon tea. If it's 50 milligrams or less, it's probably not doing as much as what that person is
Mhm.
doing. Now, if she's replaced that cinnamon tea with from a sugary coffee,
Mhm.
that would help.
Right.
So it
Definitely.
just depends on what's been replaced with that.
And what kind of tea, because we know certain teas can increase your metabolism and help with things as well. So there's a couple different factors.
Yeah, like a
with
green
that.
tea mixed
Mhm.
in with a green tea would be absolutely good. And she does cinnamon sticks. Yeah, so it
Mhm.
really depends on how much cinnamon is actually getting into that
Right.
tea and how many milligrams she's ingesting.
Yep. And like we said, we're going based off of what's been studied and what's actually been shown to have results.
Yep.
Now, a lot of what these supplements claim, and they may have some, a little bit of research behind it. And it's not saying that some of them don't work. We just wanted to share with you exactly kind of
Yeah.
what
has been studied.
Mhm.
So keep the questions going. I'm going to show you guys the next one that we've planned to talk about, but we can always go somewhere else. The next one is chromium. So chromium, Christine, how often do you get asked about this one?
I think I have never been asked about chromium, to be honest.
Yeah, we get asked, Dr. Bhargava and I have been asked in our clinic days about chromium. I do have a couple of patients that are on it. So supposedly chromium is allowing your body to have insulin work a little bit longer at that receptor that it works at. So you have the same amount of insulin in the body, it just works a little bit better because it sits where it needs to sit a little bit better. Oh, you're saying that you're not seeing our pictures. Thanks, Tyler.
There
we go.
Sometimes we have technical difficulties here.
I'm balancing all of
and
this
that's
on one
okay.
screen. So you can see our beautiful pictures. There's our probiotics.
And our cinnamon.
There's our cinnamon.
One thing I thought was interesting though about chromium is what they discovered was patients that had to have TPN therapy. So that essentially where you had to get nutrition through veins. After a few weeks, those patients were actually developing diabetes-like symptoms.
Mm-hmm.
And then they realized, like chromium actually plays a role in this. Mm-hmm. And so now those are supplemented with chromium.
Yes.
But a lot of times you have to be careful with too much chromium.
Yes, you do. You do have to watch out with too much chromium. So if you are somebody who, especially if you have kidney disease, mm-hmm. you really got to watch that chromium level. So if you do have chronic kidney disease due to diabetes, this may not be the supplement for you. If you're generally healthy besides the diabetes, this is one that if you want to try it to see if it has an effect, there has been shown some potential effect here. Very, very small amount of evidence though.
And there's some chromium just in multivitamins as well. So that may just be enough to supplement as well.
Because it's not one that you have to get 6 grams a day of.
Right.
It's
you don't want to have too much chromium. You can have some side effects with that.
Okay. Keep the pictures coming.
All right. Let's see what we got next.
I think this one is going to be fiber.
Oh, fiber. That's one of the things that if I could have all my patients do is increase their fiber.
Our patients hear about fiber, fiber.
They do. I like fiber. There's some reasons why though. And when I'm talking to my patients about fiber, I'm talking specifically either about fiber from your foods. A lot of times your non-soluble fiber, so like your leafy vegetables, your celery. But if you're going to do a fiber supplement, then like a psyllium-based fiber. So non-soluble is the first thing I talk about. And here's why. One, it helps you to feel fuller sooner. And this is not like a fiber pill. A lot of times people are like, I don't like fiber because it gets like thick on the bottom. But actually, if you're mixing that or have it in a shaker, but that thickness in your gut actually is what slows down absorption, which makes you feel fuller sooner. It actually prevents some of the absorption of cholesterol from our food, which all of us don't want to have, lower cholesterol, right? It's food for our gut critters. So it's going to make you feel fuller sooner. And because it kind of slows down that digestion, you're not going to have as many spikes with your blood sugars after you eat. Yeah. And it's been shown that if you get, 30 grams or so a day, it does have benefits with weight loss also. So a lot of benefits for your diabetes. So a lot of my patients, I say, especially if you're having issues with portion control, is to drink a glass of cold fiber water before your major meal of the day or a couple major meals of the day. That's going to have you eat less, and then you get all those benefits as well.
So if you're talking, you're the psyllium based, there are a couple of different brands. We don't promote any particular brand, but there are psyllium. It's PSY if you're trying to spell that. How much do you tell them? 1 scoop?
Usually most of them, like your Metamucil, your Benefiber, and usually it's 2 scoops is the dose, which is about 6 grams or so.
And then you do it right away before you eat, right? And then it kind of makes you feel full, just one from the liquid.
Right.
And then also from the fiber itself. So I love that advice. And just like you were saying, you may be eating a little bit less to a similar amount, but with that slower digestion, you're not getting the peak.
Right.
So instead of going straight up, it's curving, and it's curving longer. And our body is able to handle that, and your insulin can respond a little bit better. Even if you're making it or injecting it, it's going to respond a little bit better to that.
Yeah, and then you're not having those spikes in blood sugar, which you're not feeling as fatigued. But actually, the cold water, we talked about this on one of our other episodes, cold water and the fiber both increase your metabolism. So you're actually burning more calories.
Yeah.
Just by doing that.
Just cold water. And I love that. Sometimes I drink cold water and it just wakes me up too.
Yeah. And Tyler had a question. I think we just answered that as far as
how much to take. So not a huge fan of vegetables. We'll eat some occasionally. I do hope you do.
Yeah, and we're going to talk about that though in a few minutes with those who don't like to eat their vegetables.
Yeah. But how much should you use? So check it out. There's different flavors. And just like you said, we want more of the powder. The powdered fiber is more of what we're looking for versus the gummies or tablets or something that you can chew.
Right. And the studies have shown around 30 grams a day, if you can get that much, is what studies have shown to help with the lowering the A1C and the weight loss.
The other thing with fiber, you have the soluble fiber, which can come with a supplement that we call aloe vera. I get asked about once in a while as well, and you'll see that online that can help. So aloe vera can lower your blood sugars a little bit, but that comes more from the soluble fiber that is in it. So I think it's beneficial for similar reasons as to why we're seeing the beneficial effects from the psyllium. Do watch out with too much aloe vera as well. If it comes in liquid form, if you're taking it in that liquid form, it will cause GI distress. Too much, you will cause diarrhea.
Yep.
Always want to warn.
Yeah, we don't want to be chugging on the aloe and then not having a good day later.
Yeah. So this next one, I believe this was, we'll go here. So we'll talk about olive collagen. That was our collagen.
Okay. There are different forms of collagen. I personally am a big fan of collagen. As we get older, our bodies naturally lose collagen. which does make it harder to build lean muscle.
Mhm.
Collagen also helps in our joints. And
Yep.
so as we lose collagen, then increase in knee pain and joint pain and so forth,
Mhm.
which makes it harder to want to do those everyday tasks that
Yeah.
we enjoy doing.
I'll stop you. I actually don't know much about collagen. I know you talk about it all day, every day. I don't know.
Well,
I
not
think
quite that
collagen,
much.
I think like skin and
Mhm.
hair.
Right.
That's what I think. But I do remember from school that it's also in our joints as well.
Yeah,
So-
collagen is the most abundant protein in the body. So yes, skin and hair, you think
Mhm.
about that, but our muscles and joints and even bones and so forth all are made of collagen. There's actually an interesting study with those with osteopenia and osteoporosis on a collagen supplement for a year and showed improvement.
Oh, cool.
So there's a lot of studies and so forth behind collagen. What's interesting is if your blood sugars are high, it can actually bind to the collagen that's in your body and make it dysfunctional.
Okay.
And so if as we get older, we know we lose collagen, then blood sugars are high, we actually lose even more collagen.
Okay.
And so those with diabetes can get some premature aging and issues with joints and muscles and so forth.
More aches and pains. Okay.
And then less ability to make muscle, which we know muscle uses sugar as its fuel.
Yeah.
Muscle helps to increase our metabolism. It helps with maintaining proper weight.
Yeah.
And so there's a lot of things with that adding a collagen supplement can really help those with diabetes.
I've been thinking about it. Now I need to know. Now I need to go.
Yeah.
So I really like that idea because muscle mass, like we've been
Right.
preaching muscle.
Mhm.
Muscle burns fat, muscle burns sugars,
Right.
is what I would say. Muscle burns sugars. And so anything that will help us maintain that muscle mass,
Right.
should help. So cool. I like this. I got to learn something today.
Both of us.
The next slide that I do have is like, how do you get, we've talked about many different things. I do want to do this poll.
Okay.
How do you get what foods do you get your vitamins and
Mhm.
minerals from? Food is nutrition. Nutrition is medicine. So I definitely want to get all of it. But where do you guys get all of your stuff? So do you guys get most of your nutrients from vegetables? Do you get them from fruits? Let us know.
Yeah. Protein, carbs, supplements, a little of everything.
We'll give you a minute to
Mhm.
think about that. I do really good with vegetables, protein, and carbs. I'm not very good with fruits. How about you?
I try to do a little bit of everything
Uh-huh.
with that one.
Yeah.
It takes some planning though.
It does.
If I don't plan,
Uh-huh.
then there is less of the veggie fruit portion in there.
Yeah, and I'm not a sweet tooth, so I don't go towards the
Mhm.
fruits. Whereas the vegetables, I can usually make them
Yeah.
the way I like them, and I just go more towards those. And so I would definitely agree. If I don't plan, the fruits just don't go on my plate.
And you mentioned the sweets. A lot of times, I have my patients that say, well, I just am craving sweets all the time. And what's interesting is when your body is craving sweets or salty or fried, it actually doesn't need or want that. But
Okay.
Unfortunately, it doesn't give us like a little printout like, do.
This is what you need.
This is what I'm missing. And so I'm telling you, you're hungry and that you want sweets or you want this. But really, it's lacking a nutrient.
Okay.
And so the more you can have a balanced diet with nutrients,
Yeah.
you're going to find less sweet cravings.
Mhm.
You're not going to be as hungry
Mhm.
because you're actually giving your body what it needs.
I absolutely agree with that. I also give the recommendation of using fruit as a dessert.
Exactly. Yeah.
Because then you get the nutrients, you
Yeah.
get all of those vitamins, and then you're able to satisfy that little sweet that you think you need.
Yeah. And your berries are a great option for those with diabetes because they're typically lower in sugar but have a
Mhm.
ton of antioxidants in them.
Yes.
That's where we get some of our rainbow that we're
Yeah, our rainbow of
Mhm.
colors that we talked about in our last video.
your strawberries, your blackberries, your blueberries, your raspberries. I mean, there's a rainbow right there in itself.
Yeah.
That's a good option for those
Yeah.
sweets.
So what if you can't? So I struggle. I told you I struggle with
Yeah.
the fruits. You sometimes struggle with some of those
Mhm.
as well. What do you do?
I personally, so my kids like blue plate special dinner. So sometimes we eat at like 4:45, like 5 o'clock. And so by 8 o'clock, I'm like, okay, well, I'm like hungry
I'm
again.
starving, right?
But I don't want to like eat another meal because I know it's going to affect my stomach acid and it's just going to go to my legs and everything else. So I actually do like a greens and reds mix
Okay.
with some of my collagen. I mix all that together with a little bit of like V8 healthy greens
Okay.
because I like that one because it doesn't have a lot of sugar. It has no added preservatives. It's just mostly veggies and then the fruit, and it's low in calories and sugar.
So tell me about the greens and the reds mix and kind of describe what you're talking about.
Yeah, so it's a powder. And you know, with your greens, it has a lot of like your kale and your spinach and avocado.
Mhm.
And essentially a lot of those nutrients, even some probiotics are in there, that your body needs to function properly.
Okay.
Yeah, it can give you extra energy.
Mhm.
Obviously, it helps with those gut critters that we talked about,
Yeah.
reducing inflammation. And then same idea with the reds, with the antioxidant properties, also the anti-inflammatories. Because a lot of time, realistically, we get busy and not everybody gets those 4 servings of vegetables a day
Nope.
that we're supposed to get. Plus I mentioned trying to get 30 grams of fiber in,
Mhm.
depending on what you're eating. Obviously that could happen with grains and so
I
forth
mean,
also.
You're avoiding carbs, you're getting your fiber, you're now seeing 4 servings of fruits and vegetables. It
can be a lot, right? And sometimes with our schedules and lifestyles and so forth, it's not always realistic.
Yeah.
But if I know that I can, do a mix and drink that and get a lot of the nutrients that my body needs, I'm going to do it because it makes me feel better.
I used to, just story time, used to be stare at your water bottle. You used to bring a water bottle in when you were kind of here at the beginning, and you'd have your green drink in it. And I'd be like, that drink is green. It looks kind of gross, but you make it delicious, right?
I do try to make it delicious. You never shared that with me before.
I know.
I used to stare at
I was
my
like,
green
there's, I'm
drink.
staring at her drink. And so, Tyler, if you are one that does struggle with some of that, forcing yourself to eat the vegetables, trying a powder and then working it into your busy lifestyle could be an option for you. So I liked the story that you told with the blue plate special and able to work it into your lifestyle, because I find that when my life gets busy, when I'm going fast food, I have those weeks where I am, because I'm running from ball field to practice and from work and everywhere. And we just go through a drive-through. Right. I'm hungrier, even though the calorie amount that I ate was probably more than I had if I would have cooked at home. Right. And it's because of that lack of nutrients.
Yeah, hunger is not based on calorie intake. Your body tells you you're hungry based on nutritional intake. And that's a big misconception. Because when you have those days, you're like hungry all day and you've literally been eating all day and you're like, okay, I had just consumed like 4,000 calories. How am I still hungry?
Like chips and guac.
Yeah. And you're like, this makes zero sense, but it's because you did not give your body what it needs. So if you need to supplement, that's going to help in, overeating and energy and everything else.
That's a really good idea. You guys have answered so many or asked so many questions. We've answered a lot. We're coming up to about that half an hour time point. I just kind of want to summarize. We didn't really talk about the supplements that didn't work. I brought that slide up real briefly.
Right. Yeah, so let's show that, because we do want to share that with you guys.
I am going to go back to that and make sure I share my screen.
Now we know. There we go.
Kind of the summary, the big takeaway, we've got a lot of supplements that are possibly effective. Ones that if you wanted to try, there's probably little harm in trying them.
Right.
On the other side, we have those, no, you probably should stay away from them if you're looking for them to improve your diabetes.
Right. So that first one is vitamin E, and that actually has been studied some for fatty liver, but not in the realm of diabetes extensively at this point.
Yeah, so not in diabetes. Same thing with St. John's wort. It's not going to help with diabetes. It could maybe help in some other disease states, some mood disorders, but even then it's minimal benefit and so many drug interactions. So all of these, if you are going to start something, do check with a pharmacist, check with your doctors,
Right.
check with somebody to make sure it's not interacting with any of the drugs that you're doing.
Mhm.
Hot topic, vitamin D. Is that beneficial?
Well, vitamin D definitely affects the absorption of calcium.
So it has some really good
Mhm.
benefits if you're worried about your bone strength and osteoporosis. It has some benefits with mood as
Mhm.
well. When you're looking at what it's going to do with diabetes, minimal direct effect on your sugars.
Yep.
So
That ALA, there was
Yes.
one study with that in women that did show some improvement in blood sugars, but it's very limited
Yep.
data is that as
and
well.
it's too preliminary at this point for
Mhm.
us to recommend on any of the ones on our right hand side.
Right.
So really good questions. Even if we haven't covered your topic, your supplement that you're looking for, do type in a question after the fact. We will research if we don't know about it, and
Mhm.
we'll come back to you with our honest opinion.
Yeah.
So we are here to help. We are happy to help you guys out. Excited that it is summertime, that we are able to live outside a little bit more. The last quote that I have for you, and we've already kind of said it, is eat your rainbow.
Yeah.
Eat your rainbow, not your Skittle rainbow. Eat your fruits and vegetables.
When we say taste the rainbow, it has a little difference than the
Yes.
Skittles, right?
Yes.
Okay.
So if you're eating your rainbow with foods, you're going to get a whole lot of the nutrients that you need, and the
Mhm.
likelihood of needing the supplements is less. If
Right.
you're struggling to eat the rainbow,
Mhm.
check out some of the things that we've talked
Right.
about.
Exactly. And we talk
Yeah.
about different gut critters like different colors of the rainbow. So that's why we kind of want to diversify that a little bit.
Absolutely. So we will let you guys go for now. Like I said, we're excited to talk with you
Mhm.
every single time, share our information. So keep watching, keep sending us questions, and we'll be back in a couple of weeks with a new topic.
Thanks, everybody.